social media has kind of hit the stage, but no one's really dove into really where the meaningful data points are in social media. So we've written about it. People have basically said that it's out there and it's going to have an impact, but no one's really started to look into how that's going to make an impact in healthcare and for our patients. And so this issue, I think, gave us an opportunity to start diving a little bit deeper into social media as a discipline.
What was particularly fascinating about this issue was our ability to put together a multitude of opinions across what I tend to think of as an enterprise mission. We got it at the clinical level, we got it at the level of training and education, we got it at the level of promotion, and ultimately we got it at the level of how does it benefit scholarly publishing, and how can we harness the power of social media and Twitter in particular to magnify our message. So how did the issue come together?
It was really fun to put this together because there's so many different disciplines. You had psychiatry and emergency room physicians and radiologists and everybody really finding the JACR as a place for this. And so the most fun thing about this was that the contacts that we reached out to be authors, we got to know most of them through social media.
Exactly.
And so I found that to be really fun.
Well, what sealed it for me regarding the impact of social media and the ability to bring people together, we were on a tweet chat. Someone suggested that someone should write an article on the impact of social media in medicine, and then we just solicited articles on the same tweet chat, and then people would direct message us or tweet us and say, hey, I would like to volunteer. To me, that is the power of the medium.
Right. Yeah, to put together a group of people like this, you would never be able to get this diversity just if you solicited out to former colleagues or people that you work with. So to be able to find new relationships, new contributors, new people in the scholarly space, and give them a home in the JACR, I think was super rewarding.
So where do you see this going?
I think now we've laid the groundwork for what the answers we need, or the questions we need to answer with social media. With knowledge translation and patient behaviors. The next step for us is figuring out how do we meaningfully collect the data points that are available in social media? How do we construct databases or data warehouses with media and information that we can go to the next level with? And I think that this issue laid out really nicely the important things that social media research should focus on.
What really resonates with me about what you said was taking it to the next level. We've described the impact of social media on meetings. We know that. We can compare across meetings. To me, that's the same type of analysis. We need new analyses like, how can we integrate Twitter information or social media information with direct health outcomes? Like, does their blood pressure rise? Can we measure depression by the quality of their tweets? All of those things are data points for patients' clinical well-being. And collectively, what I'd like us to be able to do is to host these types of projects and really harness our ability to measure large data sets, big data, and then really use emerging algorithms such as machine learning algorithms and really figure out a way to delve much deeper into the richness of the data.
Yep, absolutely.